And to your point on the week before your period, the thing that I have found to be the most mind-blowing for me as a woman is that I pushed through that week in so many ways for so many months, for so many years.
Yeah.
Every time I had a carb craving, every time I didn't feel like doing something, I would create a story in my head of laziness and why couldn't I do that? And I really want women to understand that you are a different hormonal beast that week before your period. And once you understand the pattern that's right for you, it'll blow your mind that once your actual cycle starts, you actually start feeling better. Like even on day one, like you start bleeding and you're like, oh, hallelujah.
It's like an orgasm. It's like a release. It's like, oh, it's here. And one more thing I will say in my quest to inspire women to lift weights at whatever age they are. In the luteal phase, we are also a bit more insulin resistant, right? Just typically a bit more insulin resistant than we are in the follicular phase. So one of the things, of course, that you can do is whenever you are weight training and you are putting on more muscle, taking up glucose from the system at least into the skeletal muscle, is an insulin independent process. So you can, the more muscle that you can put on over the course of your life, the better glucose disposal agent you will be. And you don't need insulin to do it, because in the muscle, we see glucose taken up by a different, it's like it's called GLUT4. So we see this passive movement of glucose from the plasma into the cell, and it's done without insulin. So the more muscle that you can put on, the more insulin sensitive, let's say, you can stay in that luteal phase.
Amazing. Yeah. Amazing. Yeah. And I think that the trend towards muscle, I hope for women, like I hope the women listening to us understand that you got to build muscle. You got to. And I really think, which leads us to the next topic, which is after 40, pick those weights up, girl. Like put the running shoes down, pick up the weights. Your menopausal symptoms will be dramatically different if you do that. So let's talk a little bit about what happens after 40, because I can tell you as a 52-year-old woman, nobody tapped me on the shoulder and said, hey, guess what? In your 40s, everything's going to hormonally change. And so every part of your lifestyle needs to change.
Yeah, I think really starting at about 35, we start to see changes in the concentration and the amount of progesterone that we produce every month. So progesterone only shows up in the luteal phase, helps us with our sleep, helps us chill out, activates GABA receptors. It turns into a neurosteroid, allopregnanolone, and then activates the GABA receptors, which is why sometimes in the luteal phase, at least in week 3, you'll find that you get really towards the end of week 3 when progesterone tends to peak, is you'll have some of the best sleep of your life. And you're a little bit more like, it helps to kind of alleviate, it should help to alleviate anxiety, feelings of nervousness, depression, that kind of thing. So in our 40s, as we are just naturally, as a natural consequence of aging, starting to see this sort of stepwise decline in progesterone over the years, one of the first things that I'll usually ask, and people have a lot of pushback on this because no one wants to admit that they're anxious or depressed, is they'll say, yeah, like I'm feeling, I worry more. I have a hard time turning my mind off at night. Yep. Like I'm at the end of the day, like replaying the events, or like I'm just this constant, like it's this worrier kind of mentality and this inability to shut off the mind in the evening. That's usually kind of a clinical indication that maybe the progesterone is starting to decline.
Yeah. That was so politely said. I'm like, where did fucking progesterone go? Like, man, like if I could go back to my 25-year-old self, I would just love on progesterone. I would thank her every day, because when I was 45 and she wasn't there for me, I felt like
where did you go, bestie? We've been best friends for so long and you just dumped me. It's like a girlfriend breakup. Yeah. It's hard. It's hard. And I think that and then in kind of as you progress through your 40s, there's almost like kind of 3 or 4 stages of perimenopause, right? So you start to see this like contraction of the cycle initially, where let's say you've been like I've always been like a, 29 and a half to 30 day girl. Like I've kind of always, and then like now I'm noticing I'm kind of approaching mid 40s now. I'm like, oh, I've lost a day. Like I'm 28 now. Like still within normal range, but it's like, oh, I'm shorter, like a day shorter now. And then actually I have, I think I mentioned this to you last time. One of my ovaries is like a little shorter than so like every other month it's
lags.
Like, it's a laggy one. So it's like every other month it's like 27 and then it's 28. So my I can't remember which one it is. It might be my right ovary. Anyway,
so does that mean like our ovaries are like our children? Like just because we have them doesn't mean their personalities are the same?
They're sisters. They're not twins. Yeah. They're a little different, but yeah.
Yeah. I never thought of that, but you're right. And sometimes you feel a little bit of pain in one and then not in the other.
Yeah. Yeah. And I actually, I know when I've ovulated, I feel it. It's, there's like a little bit of cramping for me that not everybody has that, but I remember when I was having my, when I was trying to conceive my children, like I was like, I'm pregnant. Like I knew it. I knew the moment it happened. I was like, I'm pregnant. I know it even before, all the tests or whatever could tell me that I was pregnant. I knew it.
Yeah. Me too, by the way, with both of them, I was like, boom, like within days I knew. So very, very true. Yeah. I love that. It's so great. But here's what I see in perimenopausal women is that as estrogen goes down, collagen goes down.
Yeah. And your skin texture and hair and Mm-hmm.
Skin, hair, you're more prone to injury. Injuries hang around a lot more. Mm-hmm. So do you feel like women over 40, I agree with you that 35, we're starting to see a lot of perimenopause symptoms. Do you feel like that's the time to up collagen and up it throughout the whole cycle?
Oh, that's a really good question. I think in the context of muscle building, collagen is a terrible form of protein. So it doesn't do anything. It's not anabolic to skeletal tissue, but it is, to your point, very important for skin, hair, and nails. I don't know if I have a cyclical cadence around collagen supplementation. I typically will have some collagen, I'm 44 now, so I will have collagen almost every day. So I'll usually, but I don't count it to like, if I usually will train in the morning. That's kind of the time I get to train, and I'll put some whey protein because I know that that's anabolic to skeletal muscle. Meaning it'll stimulate growth. And I'll also put a little scoop of collagen in there because I know that, I've been sweating and it's just like the time that I'm going to remember it. I don't cycle it in any way, but I do think that it is an important consideration for women because that's one of the things that I hear. They're like, I'm 45 or I'm 48 and like my skin is just not the same. Like I can pinch it now. It's like, it doesn't have the same suppleness. So I do think that collagen is important for, and even just our joints, right? And our ligaments. So this is also like from we can talk about it being vein, and I'm totally a vein woman. So I'm like, I want good skin, hair, and nails. So I'm totally taking the collagen. But also the structural elements that allow for the muscles to move, right? It's really important for our discs. It's important for our cartilage. It's important for our bones. It's important for everything. So I typically take a scoop, and I'm trying to think of what the scoop is now. I want to say maybe 20 grams of hydrolyzed collagen, maybe. I don't know.
The powder I use, I only know the protein is like 17 grams of protein. But your point is really well taken, that just because it's 17 grams of protein doesn't mean that it's the best protein source
for your muscles.
For your muscles,
but it is a really great. It is a really great source for your ligaments and your collagen and your discs and your skin and your hair and your nails. So we want to be thinking about different proteins for different goals, right? We want, like, in my opinion, animal protein and a derivative of it, whey protein, is going to be the most bioavailable full complement of amino acids for musculoskeletal repair and for muscle protein synthesis. Collagen doesn't do that. Collagen does not do anything for our muscles. It's just really all about kind of the structural elements that we care about with collagen.
And do you think this is another thought that I've had when I watch 48-year-old women or women in their after 45, they're getting injuries, perhaps athletic injuries, and they're not resolving as quickly.
Yeah.
That is a trend that I see over and over and over again. And so what I noticed in clinical practice was if we could bring in some collagen and even mega dose with collagen, like 2-3 scoops of collagen a day, we could start to help resolve these injuries. I'm even next week speaking at a chiropractic conference here, the Wave, and I'm going to show
nice.
I'm going to show chiropractors how we need to pay attention to the changes in collagen and the changes in hormones around even something as simple and as powerful as a chiropractic adjustment, because it really makes a difference for overall integrity of the joint. So,
and when you're talking about injuries, you're talking about like ligamentous injuries, joint injuries, that kind of thing. Yeah. Okay. That totally makes 100% sense. Yeah. And one of the things that we know about those structures, unfortunately, particularly ligaments, very poor blood supply. Right. So if you have a you have a muscle injury, we know that like there's a lot of blood that feeds that muscle because it's functional contractile tissue. It's how we move. Ligaments, unfortunately, don't have a really great blood supply. So they often take longer naturally anyway, whether you're 25 or 55. But to your point, when you're older, of course, we have, let's say, and especially in our menopausal years, we start to behave, at least our cardiovascular, cardiopulmonary system starts to behave more like men. So that, under the influence of estrogen in our reproductive years, that does positively influence the vasoconstriction and vasodilation of our arteries, which is why actually when we just look at cardiovascular disease, we see that men will get it earlier than women. There's a kind of this phasic shift. Like men will get it 10 to 15 years earlier than women. And it's partially because women spend about 40 years or so menstruating, right? So we have this constant turnover, and under the influence of estrogen, we keep the ability to vasodilate and vasoconstrict more active. And then in a sort of lower estrogen environment, like you see in menopause, we do start to behave more like men. So, when you say, there's women that in their 40s and 50s, let's say, who have these injuries that are just these niggling injuries that don't seem to clear up, part of that is because of the, we'll say, reduction in blood flow generally to most structures, which is why things like, making sure that you're going for low level activity all the time. I'm a huge fan of, like going for walks and, steady state cardio, and even the burst training and the weightlifting, like all of that is all good for circulatory flow. Yoga, as you mentioned, Pilates, all of these things. These are all very, very important for injuries, like let's say of the ankle, of the shoulder, of the knee, where there's a lot of ligamentous structures. I do like to do things, and I would love your thoughts on this too, just knowing your training and your background and expertise. I love to try to bring as much blood flow in there as possible. So the collagen is really important. And I would also layer on things like red light therapy and heat, and trying to just as much as we can bring blood. Like it's almost contrary to the RICE, which we know, like the rest ice compression, which I was taught in chiropractic school, which has now been completely outdated and we don't do it anymore. No. But bringing more heat into the area to try and get the blood in the area to try to clean up and heal the the problem that's in the ligament, let's say.
All you've got to do is take a 47-year-old woman and put her in a hot yoga class, not like a crazy hot one, but I can tell you when I first go into a hot yoga class, I feel like I'm 25 again because of all the warming up. Now, too hot and I'm going to tear people's heads off because I'm like, I could go into like a more hot flash kind of place. But I do believe, to your point, warming up is really important. And getting heat and circulation in there, because you don't have as these hormones that are supporting really good fluid movement of the joints. And there's a whole bunch of reasons behind that. Second thing that I would say is that I feel like as you get older, as you go through the perimenopausal years and those ovaries are starting to shut down and switch the job of making sex hormones over to the adrenal glands, We have another challenge, which is if you're pushing it too hard, you're double stacking stress on the adrenals, and now all the hormones go away. And that is something that I absolutely dealt with throughout all my 40s. I mean, I kept modifying and modifying and modifying my workouts because I was watching these hormones change. And if I didn't change my workout with them, the injuries kept piling on top of each other.
I love that you brought this up because I think that this is such a big consideration in, oftentimes in our 30s, 20s and 30s, it's about child rearing and marriage. And then in our 40s and 50s, like those children are getting older, they're teenagers, which is a whole set of different challenges that you, as a parent, that you have to sort of go through. And then you also have other stressors like aging parents, let's say, or death of, important people in your life. That starts to happen, unfortunately, with more and more frequency. So it is, to your point, very important to be paying attention to stress management in your 40s and 50s, because as you said, the ovaries are like, I'm done. I've been here working hard like a maniac. Yep. I'm ready to retire. I'm going to hand over my job description and my all my duties over to the adrenals, who are now going to be tasked with making the majority of our sex hormones going forward. So if you already have sort of a higher sympathetic load, let's say, you are going to be at a disadvantage.